Abnormal vaginal discharge. So while a vaginal discharge is a notable clinical feature of a sexually transmitted infection, not all forms of vaginal discharge are abnormal or indicative of an STI. So vaginal discharge may be associated with normal physiological changes such as a menstrual cycle or pregnancy. And increased discharge may also occur with the presence or the use of foreign substances such as the intrauterine contraceptive device as IUCD. So careful history taking should reveal whether a vaginal discharge is abnormal or if it is associated with the use of chemical substances, for example, topical self-medication, repeated dosing with abrasive substances, or indeed due to an STI. So changes in the characteristics of a woman's vaginal discharge, either in color or the amount, and the presence of additional symptoms and signs, such as soreness and itchiness, indicates a need for medical attention. Abnormal vaginal discharge due to STIs may result in serious pelvic inflammation with sequelae such as ectopic pregnancy and infertility. So careful risk assessment is therefore required of women presenting with a vaginal discharge in order to identify the possible causes and provide appropriate treatment regimens based on the most likely etiology of the vaginal discharge. So factors that must also be considered when selecting treatment for patients include pregnancy status and patient discomfort. Additionally, the syndromic approach must be used to assess the patient, identify risk factors, and also to treat the likely cause of infection. So the causes STI related or non-STI related. So STI related causes are Neisseria, gonorrhea, chlamydia, trachomatis, trichomonas vaginalis. It could be green or yellow, smelly, bubbly, or frothy discharge associated with itching. For herpes simplex virus, that's following extensive first episode of infection. For non-STI related causes, they include candidiasis, as white, lumpy or thick discharge associated with itching. Bacterial vaginosis, gray or white, fishy smelling discharge, especially after sexual intercourse. Nerella vaginalis, foreign bodies, and herbal preparations could be a cause too. And the symptoms are abnormal vaginal discharge, the change in color, odor, consistency or amount, vaginal itching, vaginal swelling, pain on urination, low abdominal back pain. So the signs that are usually elicited are abnormal vaginal discharge, vulval swelling, vulval erythema, low abdominal tenderness, cervical excitation, tenderness, and cervical mucopus or erosions. That's on speculum examination. So investigations, high vaginal swab for microscopic culture and sensitivity, that's available. So the main objectives are to identify and treat non-STI vaginitis, also to assess STI risk and treat STI related infections appropriately, to prevent complications and sequelae, to treat both partners simultaneously as much as possible. Non-pharmacological treatment, promote good perianal and genital hygiene, encourage the use of loose cotton underwear, dry underwear out in the sun. You wear underwear that is dry, so you keep underwear dry, and avoid bleaching with herbal or chemical preparations, and avoid the use of medicated soaps. So pharmacological treatment, let's look at risk assessment first. The parameters used in the risk assessments for cervicitis are the patient's partner is symptomatic, that is partner has a urethral discharge. The patient is less than 21 years old. The patient is single. The patient has more than one sexual partner. The patient has had a new sexual partner in the last 3 months. So the risk assessment is said to be positive, and the treatment for cervicitis is recommended if the answer to the first one, that's the patient's partner being symptomatic, is yes, or the answer to any of the others is yes. If a woman has a vaginal discharge of no positive risk factor, you treat for vaginitis alone. And if she has a vaginal discharge and a positive risk factor, you treat for both vaginitis and cervicitis. Treatments for vaginitis due to trichomoniasis and bacterial vaginosis, you give metronidazole oral 400 milligrams 8 hourly for 5 days. Is contraindicated during the first trimester of pregnancy. Or you give metronidazole oral 2 grams that is contraindicated during the first trimester of pregnancy. Or secnidazole oral 2 grams that is also contraindicated during the first trimester of pregnancy. For treatment of vaginitis due to trichomoniasis and bacterial vaginosis for pregnant women in the first trimester, you give clindamycin cream, that's 2% vaginal and 1 applicator full at bedtime for 7 days. The treatment for vaginitis due to candidiasis, you give fluconazole oral, uncomplicated. You give 150 milligrams that as a single dose. Complicated, you give 150 milligrams 72 hourly for 3 doses, and recurrent, you give 150 milligrams daily for 10 to 14 days, followed by 150 milligrams once weekly for 6 days. Or you can give clotrimazole and vaginal tablets, 200 milligrams inserted into the vagina at night for 3 days. Or iconazole vaginal tablets, 200 milligrams inserted into the vagina at night for 3 days. And also clotrimazole cream vaginal 1% or 2%, you apply twice daily for 3 to 7 days for vulval irritation. The treatment for cervicitis due to gonorrhea, first line treatment, we give cefizine oral 400 milligrams stats and azithromycin oral 1 gram stats. Second line treatment, we give ceftriaxone IM 250 milligrams stats and azithromycin oral 1 gram stats. The treatment for cervicitis due to clindamycin, first line treatment, we give doxycycline oral 100 milligrams 12 hourly for 7 days. You avoid pregnant and nursing mothers. Or erythromycin oral 500 milligrams 6 hourly for 7 days. Or you give azithromycin oral 1 gram stat, which is recommended in pregnancy. The referral criteria, you refer all cases of recurrent vaginal discharge or treatment failures to a health facility where speculum examination can be carried out, and microbial culture and antimicrobial sensitivity tests can be done on the vaginal discharge. So let's look at a quick flow chart as abnormal vaginal discharge without speculum examination. The patient complains of vaginal discharge, vulval itching or burning. They take history and examine the patient and assess risk. The abnormal vaginal discharge or vulval erythema. So if it is present, if yes, is there lower abdominal tenderness? If yes, use a flow chart for lower abdominal pain. And if no, is risk assessment positive? If no, then you treat for bacterial vaginosis and trichomoniasis. If the risk assessment is positive, we treat for chlamydia, gonorrhea, bacterial vaginosis, and trichomoniasis. So abnormal vaginal discharge or vulval erythema. If no, are they other vaginal disease? If yes, use appropriate flowchart for additional treatment. If there are no vaginal diseases and you educate to counsel, you promote and provide condoms and offer CT. So on the risk assessment, if it is positive, you treat for chlamydia, gonorrhea, bacterial vaginosis, and trichomoniasis, and also you inquire if vulval edema or kid-like discharge or erythema or excoriation are present. So if yes, you treat for candidiasis. If no, you educate, you counsel, you promote, and provide condoms and offer CT. So let's look at the flow chart. Also, vaginal discharge with speculum and bimanual examination. So patient complains of vaginal discharge, vulval itching or burning. They take history and examine the patient. External, bimanual, and speculum, and assess. So cervical mucopus or cervical erosions, or was risk assessment positive? If yes, you treat for chlamydia, gonorrhea, bacterial vaginosis, and trichomoniasis. If no, you treat for bacterial vaginosis and trichomoniasis. And vulval edema or kid-like discharge, erythema or excoriation present. If yes, you treat for candidiasis. If no, you educate, you counsel, you promote and provide condoms, you offer CT, partner notification if serial cervical mucopus are present. And so offensive colored profuse discharge with or without pain indicates abnormal discharge. And the positive risk assessment, if partner has symptoms, the partner with symptoms or any of the two conditions I'm going to mention. So being single, having more than one partner, or new partner in past 3 months. So this is indicative of positive risk assessment.